Hello everyone, it's your favorite nurse Abby. This is the nurse's vlog and thank you for tuning in today. So today we're going to talk about white blood cell count and antibiotics and infection and what any of these words may mean, any of these terms mean. Let's go ahead and start talking about white blood cell counts. A normal white blood cell count when you have this lab value tested will be between 4,000 and 11,000. Typically in the hospital, our numbers will be a little different. We're really concerned if the number is greater than 12,000, depending on your hospital policy. But overall, in general, if your white blood cell count is lower than 4,000, that would indicate a problem. If your white blood cell count is greater than 11,000, that should indicate a problem. I don't want to talk too much about low white blood cell counts today. I want to talk mostly about high white blood cell counts, but low white blood cell count can indicate lots of different things. Mainly is indicating that your body is not going to be able to fight off an infection, since that's what white blood cells do. White blood cells, they fight off infections. Okay, so if having a low white blood cell count means you can't fight off an infection, what do you think having a high white blood cell count would indicate? Yep, you're right. An infection. That's what that indicates. So if your white blood cell count is greater than 11,000, that means there's some sort of infection there, okay? And you're gonna have to treat that. How do you treat infections? You treat them with antibiotics. Some common viruses that you guys know of is like the common cold. You can't treat that with antibiotics. The flu is not treated with antibiotics. Some other viruses, popular ones that you guys may know is HIV, that is a virus. Herpes is a virus. None of those things can be treated with antibiotics. Those require antivirals. So antibiotics are strictly for infections, bacterial infections, okay? Now, let's talk about some common bacterial infections. UTIs, that is a pretty common one. Lots of people, or pretty much everyone at some point in their life has experienced or will experience a urinary tract infection. So that one is very, very common. Pink eye, or what we call pink eye, is a bacterial infection that can be treated with antibiotic eye drops. You know, antibiotics come in eye drops, ear drops, pills. You can take it IV depending on how severe of an infection that you have. So when you have an infection such as a UTI, your doctor prescribes you some antibiotics to take them. It's really important that you take that medication till completion. Do not stop taking your antibiotics just because you feel better. Because what happens is your body builds up a resistance to the antibiotics, and it may not work the next time or whenever you need it. Let's say you start to feel better and you think that you're okay, but really the infection is still there, and you stop taking your antibiotics. Okay, now when the infection comes back full force and you want to start taking antibiotics again, you may become what we call resistant to it. So that's why you have to take your antibiotics to completion, all the way to completion. Now, what happens if you have an infection? Because you know a lot of people don't like to go to the doctor. If you have an infection and you don't get it treated, what happens? You got it. The infection doesn't just go away. Some infections will go away on their own, don't get me wrong. But if you have an infection that is not going away and it requires antibiotics and you never receive that treatment, the antibiotics that you need to get rid of that infection, it begins localized. So let's continue with our example of the bladder. If you have a urinary tract infection, that means we've located the bacteria. It is here, it is growing in the bladder, we know where it is, okay? If you allow an infection to just breed and harvest just right there in the bladder, then it can spread to other places. And this is what we call sepsis. It has now entered into your bloodstream and it's no longer just in that one specific part. It's all over. Now you need IV antibiotics. So an infection can be a really big deal if it goes untreated. Sepsis can be fatal. There's plenty of people who die from sepsis all the time, and they could have just, simply had some antibiotic treatment before it got so severe. So sepsis is a big deal in the hospital. If you're a nurse and you're watching this, you're like, yeah, we call a sepsis alert even when we think the slightest idea a person is becoming septic. Okay, they have an elevated white blood cell count. You have a temperature. And when we say temperature, we're talking about greater than 101. But most nurses are mindful, even before it gets to 101, we're already watching it like you have a low grade temperature and there's some reason why. Your heart rate is elevated, what we call tachycardic. A normal heart rate is between 60 and 100. Sometimes some people, when they have sepsis or a severe infection, their heart rate is greater than 100. It's in the 110s, it's in the 120s. That is not normal, along with a elevated white blood cell count and also with a temperature. Any of those things combined collectively. And then there's other labs that we will test along with it to, decide if you have sepsis. But those are things that you can kind of just tell off back without any additional labs that something is wrong. Something is wrong. So story time. I had this patient, I won't call the name of the hospital. That place, I still have PTSD from working at that place. So I was working at this hospital and I would never forget it. Well, actually, I have two stories. I will share the first. Let me share this one first. So I was not even taking care of this patient, okay? It just so happened a lot of nurses need to go to employee health or whatever the case was. I can't remember. Maybe it was flu shot season or whatever the case was. People needed to be up to date on the things they need to have done at employee health. So a lot of nurses were off floor and we were watching the patients. The ones who already had theirs completed were watching the patients. So on this particular day, it was very crazy. We had a lot of new grads on the floor. They were in training along with their experienced nurse, and they're all off the floor. So I'm watching these patients one day, and I go into this patient's room, and this little old lady is in there. She's easily older than 70, but pretty much a bedbound patient. But she has some cognition. She's not completely out of it. She's got a peg tube. And these are things I just walk immediately into the room and I can notice just without doing any further research. So I walk into the room, and at this time, this hospital, we had monitors in the room. It was a telemetry step-down unit. So the patient is hooked onto the monitor. And I walk into the room and I immediately notice that her heart rate is 119. Okay, she's got a peg tube. I see that there. And up on the monitor as well, you can see the blood pressure. We can see your vital signs. So I walk in, the blood pressure is 138/32 or something like that, 36. So immediately I'm like, there's a problem. So I'm talking to this woman about how she's doing, and she's like, please help me. She was like, please help me. I'm really afraid and something is not wrong. Something is wrong. My stomach hurts. And so I looked down and I looked at the peg tube and it looked okay. But the blood pressure was just so concerning to me. So I recycled it and it still came up. The systolic number was coming up okay in the 130s, 120s when I was cycling it. But the diastolic pressure was less than even the 32 that I originally saw. I had to pull out my stethoscope and take a manual pressure on this lady. And I was getting like 132/16. Really, really low numbers. I had to call in another nurse. I called in the charge nurse at the time and I'm like, listen to this. Am I getting this correctly? So I immediately called up the patient's doctor. Normally when it's my patient, I already read the labs, I already looked over everything before I even call the doctor. But I felt like, okay, maybe he can clue me in really quick. And I knew this doctor personally. But anywho, long story short, I won't go through the whole entire story. I ended up calling the rapid response on this patient. The ICU nurses all showed up and everything. And it had turned out, once we actually got into her chart, because at this time, this was not my patient. Once we actually got into her chart, her white blood cell count was 46. 46. I kid you not, I could not make this stuff up. And her diastolic pressure had been slowly trending and declining days over days over days over days. And it had gone missed and missed and missed by doctors, by nurses. by whomever, and it was just such a heartbreaking thing. They ended up rushing her out into the ICU that day. But the point that I'm trying to make is that watch your vital signs. Watch your vital signs. Sepsis can creep right in. This patient was not really exhibiting any fever, but at this point in her sepsis, she was exhibiting organ failure, okay? Anybody who has a diastolic pressure that is that low is not properly perfusing their organs. This woman was in trouble. Her BU and creatinine was elevated. Her labs were all over the place. So it was a big deal. And just making that one phone call could have meant her life. Okay? So, and then the second example of a situation where sepsis was going unnoticed, now we have a lot more stricter sepsis policies and stuff, but these things were happening back when we were still developing sepsis protocols and stuff like that. So I had this patient who was actually my patient, and I had her like 3 days in a row. Oh, no. I had her the first day. The second day she was in the ICU. On the third day when I came back to work, she was my patient again. So I remember she had gone to surgery. She had a lobectomy. She had her middle lobe taken out, or maybe it was the lower lobe on the right side. She had a piece of her lung removed, is the point that I'm trying to make. She was a chronic smoker, smoking at least a pack of cigarettes a day, and this, that, and the third. She had to have that piece of her lung removed. So anywho, the patient went down for surgery, and then she never came back to me. She went immediately to the ICU. Now here we are. I'm back at work. The patient is here. She has chest tubes, two chest tubes in. Okay. One had been accidentally snatched out at CT, and they had to replace that one. But the point is that this patient was not necessarily exhibiting a temperature, but her temperature or fever, her temperature was elevated. It was like 99.9. In the hospital, we go with greater than 101, or depends on your hospital policy, but typically greater than 101, we're calling it a full-blown fever. At this point, we're just calling it like a low-grade temperature, something to watch. However, I know, because I looked through the records and I had been taking care of her that morning, that we've been giving her Percocet around the clock. So Percocet is oxycodone and acetaminophen, which is Tylenol mixed. It's a combination drug. Tylenol reduces fever. Everybody knows that Tylenol is a fever reducer. So we're giving her this medication around the clock. She's getting Tylenol. I know that her temperature is much higher than 99.9 or whatever. It's higher than that. We're just reducing it because we're giving her Tylenol. So I've already checked that off in my mind. Her heart rate was 140. The last time when I had her heart rate was normal before she went to surgery. 60 to 100. It was in a normal range. She had surgery done. That was, these are 3 clues here. And the patient is just diaphoretic. She's sweaty, she's clammy. I look up her labs. They finally came back for the morning because for some reason those labs used to be so late at this place. Like, I'm not getting the morning labs until like 8 or 9 o'clock, and they drew them at like 4 o'clock in the morning. So, but anywho, I finally get the labs back, and I'm looking at the labs, and her white blood cell count was elevated like a greater than 40. And now this thing had been trending. It's trending, mind you. I call her physician. I could not get the doctor on the phone. I ended up seeing another doctor that was there, and he's like a part of the team, but not the one that I need to particularly speak to. And I'm like, she needs an antibiotic on board right now. We don't have infectious disease. We can't put this off on another doctor. You're here right now. Help me. Give me some antibiotics. Oh no, we're not going to give her the antibiotics. We're not going to do antibiotics. We're going to do this, that, and the third. I'm like, okay, well, we already took blood cultures once. The blood cultures are there. It's not really showing anything. Can you consult infectious disease? Like, make some type of move right now. But anywho, the family ends up getting there, and they see how bad of a condition she was in. She really looked awful, and they wanted to remove her from the facility and transfer her to another facility. So, and there was a whole situation. No, we're not going to do it. We're not going to transfer her because we can't transfer from level 1 trauma down to a level 2 trauma, which makes sense. You can't do that, but they were not getting the care that they need, or they felt like they needed. One of her chest tubes had already been pulled out. She was septic now at this point. But anywho, I ended up escalating it up to the physician administrator on call, and we had an ethical meeting and this, that, and the third, and I was able to help get that patient transferred to another facility just to avoid any more conflict with the family. But anywho, I'm ranting off. The point that I'm trying to make is that infection is something that is very, very important for you to monitor as a nurse, or even if you're a patient or a person who is having an infection, something as simple as an ear infection. You do not want to let it go untreated. You want to know the signs and symptoms of an infection, the signs and symptoms of sepsis, because you could save someone's life. You could save your own life. You could save your family member's life. All right, so I'm going to end the video there. If you guys have any questions or comments, please drop them down in the box below. And don't forget to like and subscribe to the Nurses Vlog.